Hello everyone, I am Dr. Amit. Welcome to my YouTube channel and please subscribe my YouTube channel. I hope you all are doing well. Keep your head high, don't lose hope. One day you will shine. So our today lecture is from microbiology series. Today again we'll continue with another gram-positive bacteria, Enterococci and Bacillus. Okay, so please turn your volume up and listen, my friends. Let's start our today topic. Okay. So we all know in this lab algorithm that for gram-positive bacteria we do gram staining, we get purple or blue, then we classify this into bacilli, cocci and branching filament. Then for cocci we do catalase test, then negative is streptococcus. It again divided into alpha, beta and gamma we get Enterococcus species. So we are going to talk about this Enterococcus species today, and the second one is from bacilli, that is Bacillus. Okay, so let's start our today topic. So let's talk about Enterococci. Okay, talking about its lab features. Okay, so Enterococci are gram positive, gamma hemolytic, and it grow in 6.5% NaCl, and they are catalase negative. Okay, now while talking about its two primary members, one is Enterococcus faecalis, found in feces, and another one is Enterococcus faecum. Okay, so it's a normal colonic microbiota. Okay, and another important thing is these gram-positive bacteria are resistant to penicillin G. Okay, now from clinical point of view, we must remember that Enterococci causes UTI, urinary tract infections, then biliary tract infections, and infective endocarditis. Okay, and other important thing is it's that vancomycin resistant Enterococci causes healthcare associated infection. Okay, and the virulence factor of Enterococci is LPS. Okay, lipopolysaccharide. Okay, so this is all about Enterococci. Now we'll talk about Bacillus. So first we'll talk about Bacillus cereus. Okay, so talking about its lab feature, so Bacillus cereus is a gram-positive and spore-forming gram-positive bacteria. Okay, so why it is important to know about Bacillus? Because it causes food poisoning. Okay, so it is also known for reheated rice syndrome. Okay, because their spores survive in cooking rice. Okay, so what are the two main symptoms it produces? Okay, so it's mainly depends on which type of infection it causes. Okay, so it mainly causes one emetic type and one is diarrheal type. Okay, so we all know emetic means vomiting, so it produces nausea like symptoms, vomiting within 1.5 hours. Okay, of ingestion of the toxin. Okay, and it is caused by cerulide. Okay, it's a preformed toxin. Okay, now the second type is diarrheal type, in which the patient will have watery, non-bloody. Always remember. Okay, it produces non-bloody diarrhea. Okay, then gastrointestinal pain, and it produces within 8 to 18 hours. Okay, of ingestion. Okay, so this part is important. Okay, for from management point of view. Okay, so for whenever you find that the patient is having Bacillus cereus infection, then always do supportive treatment. Okay, because antibiotics are ineffective against this gram-positive bacteria. Okay, so this is all about Bacillus cereus. Now we'll talk about Bacillus anthracis. Now let's talk about Bacillus anthracis. Okay, it is very important because many times MCQs ask from this topic. Okay, Bacillus anthracis. Okay, so talking about its lab feature, Bacillus anthracis are gram-positive, spore forming gram-positive bacteria. Okay, so while talking about its toxin, okay, it produces anthrax toxins. Okay, its toxin is called anthrax toxins, and it consists of a protective antigen. Okay, so this is a lethal factor. Okay, because what it causes, it causes macrophage apoptosis. Okay, and it also causes edema. Okay, and it increases the intracellular camp. Okay, so this is how these anthrax toxins infect our body. Okay, now it has a polypeptide chain. Okay, of poly-D-glutamate. Now sometime also this key point given in questions. Okay, medusa head. Okay, so medusa head, whenever you find medusa head in question, just think of Bacillus anthracis. Okay, Now it is of two types, okay. One is cutaneous anthrax and the another one is pulmonary anthrax, okay. So let's first talk about cutaneous anthrax, okay. So in cutaneous anthrax there will be painless papule, okay, and there will be vesicles also around the ulcer, okay. Then the ulcer will look like black scar, okay. Just look here, okay. So the ulcer look like this and these are the vesicles around it, okay, and that will be painless and necrotic. And then sometimes this progress to bacteremia and death, okay, in a patient, okay. So this is all about cutaneous anthrax. Now we'll talk about pulmonary anthrax, okay. So pulmonary anthrax is basically due to inhalation of the spore of the Bacillus anthracis, okay. So inhalation of spores from contaminated animal or animal products, okay. So the spores we inhale from animal or animal products. So we can also use it as a potential bioweapon, okay, in the wars, okay. Then it produces flu-like symptoms like fever, pulmonary hemorrhage, mediastinitis, okay. So in chest x-ray we find widened mediastinum, okay. So and it at last shock. So it is also called as wool sorter disease. Then if we find that the patient has got Bacillus anthracis infections or might get, then for prophylaxis case we can get ciprofloxacin or doxycycline, okay, when the patient or when the person is get exposed to it, okay. And we always remember that both can cause hemorrhagic meningitis, okay, the Bacillus species. So this is all about entero uh, Enterococci and Bacillus, okay. So I hope this video is useful in understanding these two gram positive bacteria. Thank you for listening. We'll soon meet in next video, so please subscribe to our YouTube channel and like our video and share with your fellow medicos. Thank you.